Hey.
Hey.
Good morning. I feel like my hands was in the cookie jar. Good morning. How are you?
I'm good and yourself.
I am well. I am well.
Is
Ooh,
it raining where you are?
yes, sir.
Here too.
Yes, sir. It's been raining. It's been raining all night, actually.
Well,
All night. I don't know what the temperature is because it went folks have been crying and complaining about the temperature. And we were like 60 degrees one day and 30
Mhm.
degrees the next. No, in the same day. I'm sorry, not even the next day.
Oh, boy.
I said, so folks, y'all do understand this, we still in winter, right? I mean, don't let the date on the calendar fool you. We still in winter. Winter don't end until the middle or the 20 something of March, right?
Well, you know what anybody over 72 is going to say?
What they gonna say?
These are the last days.
The last days. And I was like, especially in the Midwest, this isn't new. We've been doing this for years. We get some warm weather, but it comes back. I don't know. I don't understand. Bless everybody's heart. Oh goodness. How's your week?
It went by pretty quickly, thank goodness.
Yes, praise ye
And
the Lord.
I have I have some information, but I think that's really for the meeting after the meeting.
Okay, sir. Okay, sir. I'm glad somebody got something because it's been bananas over here. Cool, cool. All right, all right. So I guess we get this party started. Everything's everything on here. No, nothing. Look at God. Won't He do it? Won't He
All the
do it?
time.
Well, welcome to our Saturday morning tea where we discuss health information, news, education, certification tips, and entrepreneurship, and the revenue cycle at large. All of the things related to all of the things.
Good
as
morning.
you as you come into the room, as you come on the video, see, I'm still thinking about Clubhouse. I talked about them the other day. That's what that was. Don't forget to hit the thumbs up or like button. I'm Clarice Warner. Struggling this morning. I'm Clarice Warner, the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance in education. First, let me ask you, do you know what it takes to be a certified marketable medical coder? Do you really? Okay. Well, before I introduce my co host, let me share with you information on a free, yes, free 99 email course, real quick, small course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. All right, all right. So if you are interested in getting more information about the 5 steps to become a certified marketable medical coder, well, then check out the video description for the link at some point. Just thought about it like I don't think I put a description last night. I told you it was crazy. Okay, so joining me today is my co-host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I hail from Philadelphia, Pennsylvania.
All right, Helen.
Um, I've been in healthcare for over 30 years. In 2014, I left the bedside and began to work in HIM. And in 2020, I created a company, the Coding Nurse LLC, where I help nurses and other people in healthcare with a clinical background transition into the wonderful world of HIM.
All right, all right. And how is that going?
That is coming along pretty well. And I well this is HIM related. So uh earlier this week I met with the new um AHIMA data analytics education director
Okay.
to talk about the CHDA credential. And
Okay.
I had
Well,
I had told,
hold that for that could be the church announcement since I don't have
okay,
one.
okay.
I'm like, cause you gone. Love it though. Look at the enthusiasm. See how exciting our profession is. You never know. You never know. All right, let's see. Good morning. Good morning, Vicky. Good morning to our on the street correspondent, the crafty coder, and good morning to Tanika. Good morning. Welcome everybody.
Good
Okay,
morning.
so let's see. We're about to get into some church announcements that he didn't even know he had. But before we do that, let me remind you that this is a conversation, and you can add to the conversation by joining us in the chat. Let us know what's going on. Let us know your opinions because they do matter and are welcomed here. So don't be shy. Um, if you have a question, please put a Q in front of it so that we know it's an actual question for us and we don't miss it. So, for those who are just joining us or watching the replay, today we are diving into the shocking truth behind the 2.68 billion with a B, False Claims Act settlements in 2023. And what's up with remote CDI? Mr.
Hmm.
Jesse, you know you're going to be all over that. I already know. But first, let's let's get into our church announcements. Um, where Mr. Jesse is about to tell us he about to spill some tea, I bet. I think. Where's my music? Where's my music? There we go.
It's first Sunday too.
You know, all day. Communion Sunday, all of the things. It's going down this Sunday. Make sure y'all envelopes are filled out correctly with your tithes and offerings.
Yeah.
All right, let me clear this down. Jesse, you can go ahead with your church announcement.
All right. So I met with, actually, because of you, Clarice, you made this happen.
Okay. Look at me making things happen.
Exactly. Because about a couple weeks ago, you had shared that AHIMA has a new data analytics education director.
Yes,
Her name
yes,
is Treyana.
yes.
So I reached out to Treyana,
All
and because I'm studying data analytics now,
yes.
and I was looking at their CHDA credential, and I currently don't qualify to sit for it. So I wrote, just
Why not? Because of the RN
no,
thing?
no, because you have to have a bachelor's degree
Really? Okay.
or be an RHIT or RHIA, and I understand that. I'm not even mad with it because you have to know statistics, and basically statistics is taught.
Oh, and that is part of our, we do study that
So
in both
but
actually.
right, but it doesn't mean that you can't learn it somewhere else. But
Okay, amen.
so I reached out to her and basically asked, as she, takes on this new role, if she and her team could revisit the requirements.
Okay.
So she said that she would keep me in the loop, and she really has. So she wrote me back a few days later and asked if a micro credential would potentially help. So I said, if you
No,
still,
say no, kid.
I said, if you still have to know statistics, and that is really the sticking point for this requirement. And I told her, I said, and nowadays, I said, people are learning whole new professions on Udemy, on Coursera, and various other online entities. So I said, people know the information. So I told her, I said, if you still have to know statistics, which is the crux of the requirement, then no, that really wouldn't,
That's
that
not
what would
helping.
that do? So I said to her, I said, I'm not trying to say that. So so that led us to, so she asked me if I would be willing to meet. So we met via Teams Wednesday or Thursday this week.
Okay.
And I said to her, I said, I'm not asking you to change the credential and the requirements. I said, like I said, I understand why they have the requirement. I said, I'm only saying that there needs to be another pathway that is more reflective of what is going on today.
Mm-hmm.
So she started telling me her background. She is a nurse, and she is a nurse informaticist.
Okay.
And she was, basically saying that well, AHIMA did not set the requirement. The CCHIM, or whatever that is, they set the requirement for the credential. So she said that they couldn't just change it; it would have to go through a committee and all of that. But she said she would want to have data, to suggest, where that could be a potential. So I told her, I said, I said, AHIMA has always had a terrible marketing problem. I said, they feel as though they don't need to, and they have a lot of good programs. And I told her, I said, and their credentials really do mean something in the industry. And I told her, I said, honestly, I said, I've made the most money because of my HEMA credentials. I said, that's why this, CHDA credential could do a lot. The thing about it, I said, in this market, in this current climate, now you have people who are learning HIM, but they're not just learning HIM to go work for somebody. They're learning HIM to work for themselves.
Say it.
And
Say it.
these kinds of credentials really bolster you and separate you in the marketplace.
That's right.
So so we just had a conversation about that. And she was saying that she agrees. She said, because if someone, she said, like, for instance, if someone has a degree in anthropology, why would they be eligible but not somebody else? I said, well, exactly. And then I told her, I said, I said, if you look at the requirements for their credentials, I said, a lot of AHIMA credentials, there's an alternative pathway. So I said, actually, I said, this credential has the most restrictive requirements, and also it's the least attained credential. I said, there's only 321 people between the United States and Canada have this credential. She was like, how do you know that? I said, it's on the website.
One thing Mr. Jesse gonna do is research. I think that's our love, that what brought us together.
Mm-hmm.
Oh my
So
goodness.
she enjoyed our conversation, and she said that she would,
Nice.
keep me in the loop, and we would have further discussion. So
Nice. Well, look at you out here, um, joining the ranks with the AHIMA folks. All right now, rubbing elbows.
oh, one last thing.
Uh-oh.
I'm noticing a trend. You heard it here first.
Heard it here first. Get your tea ready.
There are a lot of tech layoffs.
Yeah.
A lot. And AHIMA has this access page, and access is if you have like a trainer credential, there's a whole separate where you have these little forums.
Mm-hmm.
Just so I get notifications, and I usually just skip past them, but this one caught my eye. A gentleman is a data scientist in education, and he asked for resources because he wants to transition into health informatics. So I'm predicting that there's going to be a whole lot of people who are currently in tech now. They're going to swoop in and come into healthcare tech. So if you're trying to get into, data analytics or anything like that, now is the time to stay ahead of the pack.
Wow. You heard it here first. You heard it here first. All right, Mr. Jesse, look at you. Bringing the tea and the... Wait a minute, somebody has a comment. I know that's right. right, bringing the tea. I love it. I love it. Well, the only church announcement I have is it's is it National Women's Month, Women's History Month, something. I think it's Women's History Month in
Oh,
March, and it's someday is International Women's Day. I don't know off the top of my head. I'm sorry, but I know women about to run this thing for this month. How about that? Do the ladies run this? Oh, okay. All while I'm playing the gospel song. Bless my whole heart. Okay. So, well, let's get into our topic for today. Let me get rid of my music. Okay. So today, I think I'll leave the CDI thing for last. Because I know that's gonna be bananas. So today, we're gonna talk about again the information behind the 2.68 billion False Claims Act. So initially, I saw this article from, I think it's Fierce Healthcare, that somebody wrote about the press release. So um, the Department of Justice had a press release on not this past Thursday before. And this is the highest number of settlements and judgments in history. It said it actually exceeded 2.68 billion in fiscal year 2023. It's the highest they've ever seen.
now, normally press releases are kind of short. That was a long press release.
It got all of everybody's business out here in these streets, which is why I was like, oh, we got to talk about this.
I mean,
Everybody's business in the street. Everybody. And some, I was like, oh my. A couple I did not know about. I was like, oh, is this what we doing? Okay. Well, first and foremost, I think the reason why the information caught my eye was because the article stressed all of the Medicare Advantage matters that the Department of Justice and the alleged false claims that they ran into for Medicare Advantage or Medicare Part C. And the one of the gentlemen, when they did the press release, kind of was standing on business and was like, don't think that this is it. We coming for y'all. So anybody that's in Medicare working for risk adjustment coding, we've been talking about this for years now. And the Department of Justice, I think they're tired of talking. Like I can show you better than I can tell you, I guess. And so they are doubling down on their efforts to get the money back that have come from these false claims. Wait a minute, let me see if I think it'll be easier if I just show this. Okay. Can you see?
Yes.
Okay. So, Cigna, they agreed to pay $172 million to resolve allegations for false claims, and failed to withdraw inaccurate and untruthful diagnosis code for its Medicare Advantage plan enrollees to increase its payments from Medicare. So I think we heard about them. It says the United States alleged that while Cigna engaged in a quote chart review program to submit additional diagnosis codes to Medicare for reimbursement, it failed to withdraw inaccurate or untruthful diagnosis codes previously submitted. So while they tried to fix it, I guess they didn't fix it right. They didn't fix it all. Martins Point Healthcare Incorporated agreed to pay $22.5 million to resolve its allegations regarding inaccurate diagnosis codes for Medicare Advantage plans enrollees. And they said, and even though they got these couple of settlements out, they're still litigating a number of other cases. So we'll find more coming in, including actions against United Health Group, Independent Health Corporation, Elevance Health, formerly Anthem, and the Kaiser Permanente Consortium. They not playing with y'all. They coming. They also, where's the one that I was like clutching my pearls? Unnecessary services and substandard care. Cornerstone Hospital Medical Center agreed to pay $21.6 million to resolve allegations that the former long-term acute care facility knowingly submitted claims for services performed by unlicensed and unauthorized students and services that were not provided or effectively worthless. And Mr. Jesse, you can jump in at any time. I'm looking at the screen so I can't see you. Or the comments, if comments are coming in. Smart Pharmacy Incorporated agreed to pay $7.4 million for, this is the, this is different. They were unnecessarily adding the antipsychotic drug aripiprazole to topical compounded pain creams to boost federal reimbursement for the compounded creams and waive patients' co-payments. Saratoga Center for Rehabilitation and Skilled Nursing Care, all of them folks, agreed to pay $7.1 million to resolve allegations that their center delivered worthless services to residents, resulting in medication errors, unnecessary falls, and the development of pressure ulcers, that the facility's physical conditions deteriorated to such a degree that the facility did not consistently maintain hot water, have an adequate linen inventory, or dispose of solid waste. Y'all, if y'all got people out in these homes, please check on your people. Please. They were still getting money from the opioid epidemic. There was a whistleblower lawsuit against RHIA. I don't see dollars on this, so I guess maybe they're still in the talks. But RHIA, you up next with the opioid endemic whistleblower lawsuit. Also, Endo Health Solutions violated the False Claims Act and caused hundreds of millions of dollars of losses to federal healthcare programs by causing the submission of false and fraudulent claim for prescriptions of Opana ER, a Schedule II opioid. They had some stuff about kickbacks. This other healthcare fraud thing got me too. Who was it?
Then they even went into like government contracting.
That part too. It was somebody
right here.
It was technology. No, it was somebody else. I'm gonna come back to them. EHR system. Next Gen that I had heard about, that I had seen. Where is that one?
Mm-hmm.
I said, oh, wait a minute. Hold up. Where is Next Gen? Oh, there we go. Next Gen Healthcare Incorporated agreed to pay $31.2 million to resolve allegations that it misrepresented the capabilities of certain versions of its EHR software by using an auxiliary product that was designed only to meet government certification criteria and otherwise was lacking in critical functionality. The government further alleged that NextGen provided unlawful remuneration in the forms of credits, often worth as much as $10,000, along with tickets to sporting events and entertainment that it gave to current customers whose recommendation of NextGen software led to a new sale. They got everybody. When I say they got everybody, they got everybody. Um, yeah, where's the lady? Where's the lady? Where's the lady? Um,
I think you talking about Peggy because I saw somebody's name Peggy in it.
somebody who did it was the contracting stuff.
Oh, because
Um,
Peggy had to pay back 325,000.
where did Peggy go?
Peggy is under.
Up here.
She was right
Executive.
under next gen in the next paragraph as right here,
Okay.
Peggy.
Yeah. They resolve numerous she's for kickback laboratories and their recruiters allege paying doctors kickbacks disguised as legitimate payments. 5 corporate entities and 10 individuals paid over $2.6 million to settle allegations of kickbacks for laboratory referrals, including sham investment distributions from management service organizations. For example, executive Peggy Borgfeld agreed to pay $325,000 and be excluded from federal healthcare programs for 5 years to resolve allegations that she falsely certified to Medicare that certain laboratory testing claims complied with the anti-kickback statute. Mm. Girl,
And then these next
lady.
two doctors, they worse.
Their medical practice agreed to pay $396,360 to settle allegations of receiving MSO kickbacks in return for their laboratory referrals. These settlements are part of an ongoing investigation, so that means it's still happening, that to date has resulted in settlements with 43 physicians and recoveries over $46 million. No, it was somebody that had a contract saying that they were I saw this Boeing thing. I said, "Oh, wait a minute."
Hmm.
They had to pay back $8.1 million or agreed to pay to resolve allegations that it submitted false claims, made false statements in connection with U.S. Navy contracts to manufacture the V-22 Osprey, a military aircraft. Now, somebody got, is this the person? Yes, Victory Automotive Group agreed to pay more than $9 million to resolve allegations that it provided false information in support of a PPP loan forgiveness application. Although the company's application certified it was a small business with fewer than 500 employees, Victory shared common operational control with dozens of automobile dealerships across the country, totaling more than 3,000 employees. For that reason, it was not eligible for the PPP loan it received, which was later forgiven. No, it's somebody else. It was something else I saw. I don't know. But here's all of the things. So, like I said, they put everybody's business out here in the streets that owed or had to repay money based on even Verizon. Based on False Claims Act.
Now the whistleblower um, information is interesting. It's towards the bottom. It's
Okay.
recoveries and whistleblower suits.
Okay. This is the one I was talking about. This person right here, Margarita Howard. That's who it was. And her company, HX5 LLC, along with affiliated joint venture HX5 Sierra LLC, paid the United States government approximately $7.8 million to resolve allegations that they knowingly provided false information to the Small Business Association related to HX5's and HX5 Sierra's eligibility for federal set-aside contracts intended for small businesses owned and controlled by socially and economically disadvantaged individuals. Yeah, they checking for that too. Okay. Whistleblowers, and I know you was all over this. Let's see, over 2.3 billion arose from lawsuits that were filed under the key TAM provisions of the False Claims Act and pursued by either the government or whistleblowers. During this time, the government paid out over $349 million to the individuals who exposed fraud and false claims by filing key TAM actions. The number of lawsuits filed under key TAM significantly rose from 1986 with 712 key TAM filed this past year. On average of more than 13 new cases every week. And they are thankful and grateful. They are thankful and grateful for the hard work and courage of whistleblowers who play a critical role in identifying fraud, often at substantial risk to themselves, says Principal Deputy Assistant Attorney General. That's a lot of title, Boynton. Our efforts to ensure that public funds are spent properly continues to benefit greatly from their actions. Yes. Yeah, because he was the one that I think was going on and on and on about the Medicare Advantage and how, he's coming. They're coming for him. And then they have all the statistics and all of the things. So, yeah.
But the sad part is, and it's just, we know that there is, I'm just going to say it. Race factors into every freaking thing in America, because you have people who are in jail right now because they got false PPP loans for like $13,000. But yet and still consistently, you have people who are able to just repay some money, be excluded from a federal program for X number of years, then you can rinse and repeat. No, if these people went to jail, this would stop. Like, no, you need to pay back the money, and you need to be behind bars in an orange jumpsuit. And it's ridiculous, but we know why.
Yes. And we know why. And folks need to make sure that when they spending their money, spend your money on your legal team. If you out here committing, messing with the church's money, as we like to say, make sure you have some protection, some good, solid coverage. We're hearing every day about all of these different, at least I've been hearing every day about all these different lawsuits and all these different claims being made against folks. And the first thing they want to talk about is they have the legal team of so and so and so who got somebody off or got a settlement through or whatever. So it's about to be a whole heyday for these attorneys, healthcare attorneys. Y'all get ready. Folks will be calling y'all. Prepare. If you're preparing to do some foolishness, prepare all the way. Prepare to the end. That's all I'm saying.
I mean,
first of all, don't do the foolishness. Let's start there. Don't do it. Don't do that. Don't play with the money. But if you do play with the money, be prepared for the consequences.
I mean, and speaking of legal teams, I have a cousin who was on
I thought you was about to tell me I was a lawyer too. Sir, I was about to be like, okay, here we go.
I have a cousin who was arrested because he got almost $1 million in PPP money. I don't know what kind of legal team he has, but he was in Florida. They moved him he is right downtown because they have a federal prison in downtown Philly. And he only got sentenced to 3 to 5 years.
Wow.
For $1 million almost?
Wow.
See.
Wow. I don't know. I don't know. Lawyer up. Y'all know y'all be watching BMF and Power and all the things. They show you to lawyer up. Especially if you're doing something you ain't got no business doing. Yeah. And the Department of Justice is not playing. They coming for everybody, every single dime. So,
And
um,
and it's so nowadays, and I'm telling you, like, it's so easy. Just with me, just learning data analytics, like, and learning SQL for the past year, like, it is so easy now to track outliers. It's so easy to find all kinds of things to lead you to,
down
even
that rabbit hole to find
yeah,
more stuff, and pile it on and get your case. Somebody told me a long time ago, like if you ever dealing with anything from the federal government, if it gets to the point where they are now talking to you, they already got their case built. They just want to see what you're gonna say. They already got their stuff. They already know. And depending on how you move and how you cooperate or not will determine. And maybe that be some of the things. Folks be standing 10 toes down. It wasn't me. Da 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 da. They're like, okay, yeah, right over. Throw the book on them. That might be some of the stuff happening as well. I don't know.
yeah.
Don't go rah rah. This ain't the Real Housewives, people. Don't do that. This is the government.
Mhm.
The government. They not playing, especially out here in these healthcare streets. All right, all right. So then this other information that we got. Okay. The other information that we got came from I call him friend of the pod, Mr. Glenn Krause. He was on our show. Was it 2 years ago? We've been
About
we've been
that,
doing this for a long time.
yeah.
um, talking about clinical documentation and improvement programs. And then I saw another article that he wrote, and I was like, oh, this one. First, I was like, what are you talking about? It was talking about um education and that providing not I don't think it was recorded education, but the type of education like you would get um in Udemy or you know in your compliance program where somebody put together, it's a name for it and I can't think of it off the top of my head, but where it's not face to face or in a room, that is pretty much
Are,
ineffective
are
for
you thinking? Are you thinking
providers.
asynchronous? Because that's what they like to use too.
I know that's what they use in academia. But yeah, ultimately, pretty much that, like where you have to, and he was saying all kinds of stuff that I was like, uh, I didn't agree with some of the stuff he said. I'll say that. But then as I got to the bottom, it was a quote advertisement, but we can help you to do da 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 da. And I was like, oh, okay, this is where you're going with this. Okay, I get it now. I understand. So this one talked about why remote clinical documentation improvement programs can be ineffective. Um, and his thoughts were that there are simply no substitute for interactive quote boots on the ground CDI programs to collaborate with physicians, case management, utilization review staff utilizing a team-based approach to derive the achievement of better documentation. He says most physicians want to document right the first time around. They prefer guidance and instruction on better practices of documentation versus repetitive, reactionary, transactional based queries issued from a remote location. And in his point, it's time for a change. Change in the CDI's current processes is inevitable. This is actually an article or post he wrote on LinkedIn. Trying to think if I can open the whole thing up. Yeah. So Mr. Jesse, what he and his case for this, he talked about access to information. He talked about technology barriers, such as poor internet connection, software glitches, or lack of familiarity with remote communication tools can impede effective communication between CDI specialists and healthcare providers. Everybody I know, well, okay. Complex cases, um, documentation challenges, team collaboration, training and oversight, and provider resistance were some of the things that he mentioned. And then he goes on to further um, speak on those things. Mr. Jesse, did you have uh
You know I do. You can't even get it out.
I can't because I'm trying to hurry up and get my tea because I know it's coming. Okay.
Um, he was, a guest on the show, but when I tell you, he is like contrarian number one. Like, I just don't understand because this article seemed to me, I'm like, well, wait a minute. Is he on this, push back? Is this like an anti-remote thing? Like, is he trying to sell it back on going back to the hospital because everybody has moved beyond that?
Yes, and
And
that's what it reads to me like, and
right,
all the reasons why, and like even the one about um the software glitches or whatever. I'm like, or technology
that
barriers, like
that can happen internally and on site.
on site.
Look, and more importantly, tell that to the hackers. but what I want to get to is out of all of his reading his missive, the part that he left out was accountability. I didn't hear that not nowhere, Mr. Krause. Nowhere. Because an effective program, period. I don't care if it's child rearing, an effective program has accountability. If you
Mm-hmm.
don't hold people accountable at the end of the day, nothing you do is going to be effective. You could sit on the top of their head. If you're not going to hold them accountable for what you tell them to do, they're not going to do it.
She said he is one of the ones that can't work from home.
So I just don't understand because, and then like these transactional, like what is a transactional query, sir? That's what I want to know. That's my question because I know I send queries all the time, and not one of them has been transactional. It has been to clarify documentation, which is what a query is supposed to do. So I don't even know what a transactional query is. And my what I don't understand is if you keep sending the same query over and over to the same providers, two things need to happen. I want to know two things. A, why are they not getting it? And B, if they're not getting it, what steps is the program going to take to make sure that they get it? Because if you have to send the same type of query repeatedly, then there's something wrong.
Mm-hmm.
Like there's truly a breakdown somewhere. And I just don't understand because, first of all, like when you talk about boots on the ground and being remote, I mean being on site, there are some places that don't have the pool to pick from to have qualified people to even do the job. So now in this, revenue obsessed environment, that we call 2024, how are these smaller hospitals supposed to get people to help them? Otherwise, that's why they sign up with these revenue cycle companies to manage
Mm-hmm.
them because they weren't able to do it, and they reached out to them because they realized they were losing money, but they didn't know how to fix it.
Mm-hmm.
So remote revenue cycle management is a fix. The
Mm-hmm.
problem is, in my opinion, the problem is not remote versus on site. It just, to me, comes down to accountability
You're
at
right.
the
You're
end of the
right.
day.
And a couple of things actually didn't. I didn't. It didn't make sense to me. So In his access to information, he says CDI specialists may face challenges in accessing complete patient information remotely. In an in-person setting, they can directly review physical charts or physical charts and interact with various healthcare professionals to gather comprehensive data. That one got me. And so he also talked about complex cases. This is certain complex cases require nuanced discussions and detailed explanations that are better facilitated through face-to-face interactions. Remote CDI often struggle to adequately address such cases without the added benefit of a candid discussion with the physician, taking advantage of the opportunity to engage in a conversation with the physician from an educational training perspective.
Let me tell you.
Are we having a face-to-face conversation right now? Okay.
I just, about 2 weeks ago, I just completed a case. And you want to talk about complex. The bill at the end of this case was $759,000.
Oh, wow.
It was an inpatient stay for 50 days.
Ooh.
I read that chart through 25 of them because I didn't do it some days I did it every day because they had a lot going on. But I didn't have to. Why would I have to be on site to have a discussion about what you have to document electronically anyway? And I don't understand, like, what kind of, like, because when people talk about collaboration, I don't really need to interact with case management to do my job in CDI because case management has nothing to do with CDI.
That's right.
So the only department, to be quite honest, the only two departments that I have to rely on for information, to be perfectly honest, is every now and then a nutrition consult. If they say somebody has malnutrition, I have to query the doctor to see if they agree, or a wound care specialist. Like if they identify a wound that was not diagnosed by a physician, then I have to query the attending to see if they agree with this finding. Those are the only two departments that I interact with on a regular basis. Everybody else, no. So I'm not understanding.
It's a whole bunch of things in here I'm not understanding because he makes it sound like that one, there is a choice that folks are walking around with paper charts. I ain't seen a paper chart in a long time. So I'm not, and maybe these are our seasoned providers. Because the young providers appreciate messaging, appreciate the interaction, because he's saying there's something about perceived disruption and workflow. Well, you standing in front of somebody trying to talk to them is disrupting their workflow as well.
First of all, you have to get FaceTime, because just like somebody,
how are you getting it right?
Just like somebody can ignore your email, you could be face to face. I don't have time to talk to you.
I don't have time to talk to you. And walk on by. Walk on by.
Look, that part. So
I don't know. I was trying to be with you, but I'm seeing too many holes in this. And again, I'm trying to understand. I'm trying to understand.
He had a flashback to 2004.
Is that what it was?
Not 2024. Because for number one, because can we be very clear? We know that there are some people, probably in some remote part of Kansas, where they do have physical charts. Because if you're under a certain number of patients, you don't have to have an EA chart. So if you meet that requirement, CDI is not your concern. I can promise you.
That's the least of your concerns.
Yes. Am I getting the most out of my 10 patients? I'm not-
Oh my God. That's hilarious. They probably coding, and as we know, probably got his wife or somebody doing all of the coding, billing, denials,
Mhm,
greeting, front
mhm.
desk, back office, all of the things.
Well,
Yes.
and in charge of the potluck.
I cannot with you today. I will not with you today. Oh my goodness. Yeah, I know. I mean, I I'm all on board because believe that CDI is a wonderful program that is needed both inpatient and outpatient. I'm just trying to understand the fairy tale here. I feel like this is, that he's living under that is going to revert back to, like you said, 2004, I guess.
But I mean, as somebody who works in inpatient CDI, I can see the benefit of my job every day because part of, well, the function of CDI is to clarify documentation.
Mm-hmm.
And by clarifying documentation, you can either support your case or you can prevent a future denial.
Mm-hmm.
Because if you are reading that record and you see a diagnosis and there is no clinical validity for this diagnosis, if you can't read through and see, okay, how they came to that decision, as a CDI, you're supposed to reach out to that physician and get it clarified before that bill goes out. Because if I see it, somebody else at the insurance company is going to see it and say, no, no, no. Then you're
That's
going to
right.
have to downgrade, especially in cases where you have like a sole CC or a sole MCC that is going to boost the DRG.
Mm-hmm.
I always like when I have a sole anything. Now, if it's somebody that has 3 or 4 MCCs and then another one is sketchy, it doesn't matter because you got solid. It's going to be what
Evidence
it's
or
going to be
documentation to
regardless.
support one. Yep.
Without that, right? But
Yep.
if it's the sole one, I always scrutinize them. I just had one. I just sent 2 of them actually this past week where they were the sole and it was going to flip. I'm like, no, no, we need to now. If I ask you and you say, well, yeah, it's still there, even though it's not, then at that point, that's between you and the insurance company because I've done my job.
That's right.
I can't tell you what to do. I can only ask.
That's right. And so imagine with inpatient CDI, you do have kind of an opportunity to get the full picture or get the full scope, um, and reach out and have the discussion, um, prayerfully prior to submission. In outpatient or a physician office situation, usually them churning. So again, you're not stopping the provider to say, "Hey, sir or ma'am, can I talk to you for a minute?" While they running in, because first of all, let's be real clear. These physicians out here in these streets are stressed as hell because the money ain't the math is not mathing. And so they're increasing the hours that they're working, they're increasing the number of patients that they could possibly try to squeeze and get in, and documentation. And some folks didn't take a typing class back in the day. Your younger ones, they ready. They've been typing all their lives. Some of them older ones, they still pecking with one finger, and it's taking a long time. Um, there are remedies for that. They have the
Dragon.
transcript. I wasn't gonna call a name, but no, you're fine. Look, Dragon is not sponsoring this, but those programs that allow for transcription, you have scribes, you have all of the things that are available at your disposal, especially if you're connected to a system that can help you in that endeavor. But they're still stressed out because they working long gone are the days that they strolling in at 10 and leaving at 2. Those days don't happen anymore. Um, I knew that was gonna trigger you, the crafty coder. Oh God, don't start with the wife practice managers. I knew that was gonna trigger you. I'm sorry. um, but so they don't have time for that. They don't have time for you to bothering them. I mean, and eventually you're going to have to make that connection and have the conversation and query them to make sure that you're doing all that you do to prevent the denials on the back end. But then some folks like just do whatever and we'll deal with it when it comes back. You don't want to be playing those games either, because eventually they're going to see a pattern, and that's how low-lying fruit. They once a pattern has been developed, thank you data analytics, that's when you become on somebody's radar. Oh, well, have you seen? Well, I see. Well, this is a pattern. Well, we need to monitor this some more. And the more you do it, the longer you do it, the increase. That's how you become a target. And now you got an X on your back. And eventually somebody's going to come and say, hey, well, we've noticed that this, that, and the third. Let's have a conversation. And you're going to have to slow down for that conversation. Sorry.
You're going to have to.
You're going to have to. And why go through all of that when you can handle it in the beginning? Be proactive. So, needless to say, I was his whole article. I was like, okay, and then even the other one, I was like, okay,
because for a while I could see where he was. I'm like, okay, well, I can see.
I was raw with him because as he was helping, because initially, well, how we actually we've met face to face. That's a whole other story. But how he's always been a champion for CDI and making sure the right people are involved and are at the table and doing what they're supposed to do. So I get that. So for this to come out, I'm like, well, this now you splitting hairs in CDI, because at the end of the day, you don't need anybody to now be like, well, do we really need it, or is it not? No, it's already been proven that it's a function that needs to stay. No need to split the hairs to make anybody think, well, maybe this is y'all. It's so many folks being laid off. Y'all need to stop. Don't do that. Let that one go. Keep cheerleading and supporting. All right. Well, Mr. Jesse.
This was a good show. I mean, as they all are, but I really enjoyed our topics.
We always looking about where the money resides. Follow the money. We always say follow the money.
You got to
follow the money. And I'm thinking back, even like tying this together. If you think about the risk assessment programs and processes where they're actually going in and doing, who got time for that? Nobody.
But I also I have to admit that I do have a healthy bit of skepticism. And I was just thinking, because when you were talking about United Health Group, I was just thinking, they're part of this ongoing investigation with the government. Don't you find it, look, as Dr. Umar says, don't you find it suspicious that they just got hacked like 2 weeks ago?
Oh, so here we go with the conspiracy.
Yes, information comes up missing, or they can't get it back. See,
everything is gone. We don't even know what you're talking about.
Exactly. Look,
we have no idea.
Look, what overpayment?
What overpayment? What chart? What patient? Yes. People don't even exist. We ain't never seen them people. Exactly. Wow. That's interesting. And the other part of the argument too that's going to be interesting, that I'm just sitting back seeing, I feel like the color purple, seeing what color the wall is going to be, because again, Medicare Advantage they don't feel like they have to abide by traditional Medicare rules and regulations. They feel like that's beneath them. That ain't us. So that's why all of this work is happening alongside all these investigations to to show and prove and outline specifically Medicare Advantage programs, you are required to follow these rules, and this is why. So I guess because they feel special, so they gonna make special notations for them in compliance guidance on what it is that they're supposed to be doing.
There are two. Oh, go ahead.
Go ahead.
When it comes to Medicare Advantage, there are two concepts that all of these providers, all of these organizations need to keep in mind, and it would help, I think, curtail some of this excess. Two concepts. The first one is data analysis, and the second one is meat. That's all you need. Period. It's that easy. It's
that easy. I don't.
You can't outrun a record. Either you have support for it or you don't.
Or you don't. Period. Either you discussed it, you evaluated, you did all the things, you treated, and it's clearly documented, or you didn't. And if you didn't, it's okay. You live to see another day. You do it at the next appointment or whatever. But don't play the games. Don't play the games. I don't know. Bless their heart. All right, y'all. Well, we are at the top of the hour. This has been hilarious to me today. But it's been good. Because I knew the tea was coming. As soon as I saw the article. So on the background, we put together our docket or whatever that we're going to talk about. And I sent that to him and he was like, oh, I knew it as soon as I saw it. So anyway, thank you all again for joining the Saturday morning tea or checking out the replay. Let me ask, was the tea spilled today? Yes, I think so. I even learned some new stuff.
And we have to, because of his current stance, we can't call him because we already have a Papa Smurf, but Glenn Krause is Cousin Smurf.
Cousin Smurf. All right. We'll be watching Cousin Smurf for additional commentary, especially as it revolves around CDI and physician documentation. And maybe, just maybe, in some of the articles, there will be something on accountability. How about that?
How about it? Let's start with the letter A.
Let's start with be like Sesame Street or the electric company.
Yeah.
Hey, accountability. Oh my God. Okay, I'm sorry, y'all. He gonna have me laughing all day. Oh goodness. Okay. So if this information was valuable for you or tickled you like it did me, help us share this message with others by sharing the video and subscribing to the channel. Be sure to follow us for more information on all things health information, compliance, revenue cycle, and medical coding. Also, we are we have our Patreon, and so if you're interested in, and I did do a little thing, but for some reason it's not wanting to act right over here. If you're interested in getting insider tips, expert Q&A sessions, we have a resource library, exclusive content provided at least every Wednesday, and networking opportunities. Feel free to check us out. Look in the description or you can go to patreon.com/Clarice Warner, the girl with the pearls, to join our Patreon, where go ahead.
I just want to say for our listeners that, in my opinion, the Patreon is the Saturday morning tea on steroids.
Because I know I'm about to get a whole other hour of chuckles right now. And if you are any of the Smurfs, your ears gonna be burning today. Let me just say that. Oh my God. So feel free to be part of the Patreon and join us in the meeting after the meeting, which starts at 10:15 right after our Saturday morning tea. So more to come on that. If that interests you, feel free to join us and be part of our Patreon community. So again, this has been a wonderful session. Lots of information. Um, hopefully we gave you some things to chew on. Prayerfully, we gave you some things to if you are a provider, to think about, especially accountability as it relates to your practice. If you are working in health information for a particular provider, hopefully this gave you some information that you can help your provider be compliant in their documentation. Mr. Jesse, do you have any final last words?
No.
Okay.
I
Okay.
just I always thank you for creating this space. And I've always felt like, you if people are really listening to what we're saying and taking our advice, you can really make some real inroads in your career or in your business, whatever you
Hmm.
want to, whether you want to work for somebody or work for yourself. We
That's
give
right.
you the information to do both.
That's right. That's right. So as you leave out, don't forget to hit the thumbs up or like button, and also check out the Coding Nurse channel on YouTube where Mr. Jesse drops gems as well. Again, this has been a great session. Thank you for joining. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care. Have a great weekend.
Bye bye.
Bye.